going to turn it over here. We've got Tareen dermatology in the room, so I'll turn it over and she can introduce her team.
Hi everybody, today, and my name is Natalie over here. We're going to be talking today about understanding skin cancer risk for firefighters. It is my most sincere honor to introduce Dr. Tareen. She is a board-certified dermatologist, the owner of our 7 clinics, and we have another additional clinic opening in 2025. Father of 5 kids, and a lover of all firefighters, so we're really thrilled to be here.
Thank you for having me. As Natalie said, I love our firefighters and our first responders. Thank you for everything you do. I really want to talk today about the skin cancer risks that you all face because it is underreported and we really can do something about it with prevention. So
So my name is skin cancer is within our skin cells. There are 3 primary skin cancers that we see most regularly, that being squamous cell, basal cell, and melanoma. The most common one that we see is basal cell carcinoma. That is about 70% of the skin cancer that we see. This is something that can be caused a lot by sun exposure, UV radiation, but also when you get into contact with other carcinogens, mutations within skin cells, basal cell carcinoma.
if you see a pink pimple that's not going away for over 2 months, you should get in to see a dermatologist. So many people have these spots and they let them grow too big. So that's really kind of the pathognomonic, what you're looking for basal cell carcinoma, pink, shiny, pimple-like lesion that is not resolving.
Our second most common form of skin cancer is squamous cell carcinoma. This is also another skin cancer that is heavily influenced by sun exposure as well as carcinogens as well. This form of skin cancer can show up as like a pink scaly patch, but also kind of a brown raised like dry patch as well. The main thing that we're looking at is it's not going away. Some people think it's like a dry patch of skin that's just like, oh, it's winter time, it's not going away. But it's like bleeding, it looks like a scab. That's something we want to check out.
And we'll talk a little bit later, but firefighters are especially prone to squamous cell carcinoma due to the carcinogens and the heat. So this is one I really want you guys to take a look at. These hard, crusty, wart-like lesions are squamous cell carcinoma.
Our third common form of skin cancer is melanoma, and this is actually the most severe and dangerous form of skin cancer. Melanoma does have the risk to metastasize, so spreading throughout your body to other organs or other cells, and it can be fatal. We do take it pretty seriously. A lot of times melanoma can be treated within our office where we do an excision, where we cut out that skin, and we allow the body to heal together with the new cells. However, in more serious cases, we do send patients with melanoma to oncology where they can have lymph node testing and much more invasive testing to ensure that the melanoma is not spreading throughout the body.
A little mnemonic that all of you should learn, especially as first responders, you're seeing a lot of people, are the A, B, C, D for melanoma.
Yes. So A is asymmetry. If you were to put a line down the middle of a mole, it wouldn't fold into a nice like half circle. And then our other mnemonics can fall within that, which is B, border. So imagine like a very hazy border, like it's kind of the color fades out on one side. Really jaggedy border, like it's really sharp, or wobbly. It's not even all over. And then C is color, so inconsistent color, a very like dark edge or a light edge, or it's just much darker than any surrounding moles. And then D is diameter. A good way to think about it is larger than a pencil eraser or larger than any other moles or freckles you have on your body. And then E is evolving. This is changing over time, like a mole that wasn't there a year ago, or it grew twice its size, or it's growing off to one size. Those are things we look at to check off if it's an atypical mole or it's melanoma.
Actually, the studies have shown should not be getting the age of 30 to 35. So If you're developing a new mole, you probably shouldn't get in to see your dermatologist. Natalie, you want to take the quiz question?
Sure. Does anybody know who this might be? He's wasting away in Margaritaville and enjoying his life, but what famous singer recently died of skin cancer?
Jimmy Buffett.
That's right. So unfortunately, Jimmy Buffett actually died of skin cancer, a type called Merkel cell carcinoma. Merkel cell carcinoma presents as these very similar to basal cell, pink, shiny, pimple-like lesions that aren't going away. Merkel cell carcinoma is actually the second most common cause of skin cancer death after from melanoma. There's another type of skin cancer that people can die for that is not talked about. It's called lymphoma of the skin. So many of you have heard of lymphoma. That's a blood cancer, but it can actually present first on the skin as rashes or patches that aren't going away. So these are two types that you may not have heard of as much, but they're always deadly.
And how much more likely do you think firefighters are to develop melanoma skin cancer compared to the general population? Any guesses?
C.
Answer is C. Go Roger.
So now I want to delve into the meat of the presentation. Why are firefighters so high risk of skin cancer? There are 6 specific risk factors. As you can imagine, the most important one, exposure to carcinogens. As you know, firefighters are frequently exposed to harmful substances, polycyclic aromatic hydrocarbons, benzene, which we know is cancer causing, and other chemicals that are released during combustion. These substances not only settle on the skin and can be inhaled, and then they cause those DNA breaks and DNA damage that cause the cells to continue to move. Number 2, firefighters are exposed to a lot of UV radiation. As you know, many of you work outside for long periods of time. The constant UV exposure can increase all types of skin cancers in conjunction with your exposure to these other chemicals. Number 3, inadequate decontamination. Your protective gear can actually trap soot and carcinogens into the skin. So if the gear isn't cleaned properly, these substances can come in prolonged contact with the skin, cause chronic irritation, cause rashes, cause skin cancer. Do you want to tell the story of our firefighters?
Yeah, we have a retired chief firefighter as a patient. He was telling us a story about how him and his colleagues used to rub soot on each other after they were done with calls, just kind of as a way of like, when you get dirty enough, like here, you could take some of mine. However, we now know they were exposing each other to carcinogens that could cause skin cancer. So unfortunately, well, they'll have to find another way to show like brotherly love, but.
Number 4, delayed diagnosis. Firefighters always prioritize the people that they're taking care of, but they may not take care of their own health. So it's important that you get in for your routine preventative skin exams. Number 5, heat stress, and skin absorption. As you probably know, the heat actually increases the permeability of the skin, so those carcinogens can penetrate more easily. It also facilitates the sweat, opens up every pore. So sweat glands are connected to each hair follicle. And when you sweat, all those cancer-causing materials go into the hair follicles and cause DNA breakage. Number 6, I think this is very interesting. This is applicable to people like me who are doctors as well. So shift work and circadian rhythm disruption. So because you work regular shifts, overnight shifts, it disrupts your circadian rhythm. And although that may not seem stressful to you, that is actually disruptive to your body and causes your DNA not to repair itself. And this leads to not just skin cancer, but all types of cancer. So preventative measures. Natalie, Justin.
Yeah, so skin protection, staying protected when you are out on the, like the fall or just in your daily life, wearing sunscreen. We have a lot of clothing now, like SPF clothing that can be in the sun. Practices, so contaminating your gear as well as your body after calls. We've done studies that the neck and the wrist are where they find a lot of exposure to the soot, as that's where your clothing kind of connects. So wiping those down right away, as well as contaminating your gear, and then done. You don't expect you to know every mole on your body, so at least once a year, getting that on the books and getting screened is number 1. Skin cancer.
Last and probably most relevant to your everyday routine is that protective equipment. Making sure to use well maintained, properly cleaned, all of that will help.
There are now a lot of studies in the dermatologic literature about the increased risk that U.S. firefighters face. There's a recent study from last year's Journal of the American Academy of Dermatology. That's the preeminent journal of dermatology in the United States. And it showed firefighters had, as you saw, a 21% increased risk of melanoma, and they had a much higher risk of skin cancer compared to police officers. So, you know, you think of police officers often facing the same thing. No, you as firefighters have a substantially increased risk of skin cancer. One thing I want to advocate for all of you, when I had patients many years ago who were vets and had skin cancers from Agent Orange, the VA did not recognize Agent Orange as a carcinogen for skin cancer. We as dermatologists advocated for our patients that this needs to be covered on your insurance at a higher rate. You are putting yourself at risk, or vets are putting themselves at risk. Same thing. We as dermatologists now in the literature are advocating for firefighters and want the entire nation to know that firefighters should be treated for skin cancer and they should have better insurance for skin cancer protection.
So a big part of the ethos of Tareen Dermatology is the philanthropy that we do. And Dr. Tareen and her husband Foster are so generous to our communities. Our headquartered office is in Roseville, Minnesota, and we have seven locations total right now, and another location coming after the first of the year in Lakeville. We were so lucky to be able to donate funds to the Roseville Fire Department this year. We have no-show fees like any medical office typically does, and rather than pocketing money, we choose to donate it to causes in need, and we're really excited to make this donation to a group of firefighters at the door. So we wanted to share a little bit about that. And then Chief Berg is here today. We had an opportunity to meet with our fire department to do a free skin cancer screening with one of Dr. Tareen's colleagues and our team. It was very eye-opening. Many of the firefighters that we spoke with had either never seen a dermatologist before, or they didn't know that they should be coming. It's actually a common, what did you say, a common patient storyline that they come in and say, oh, I didn't know I should be doing this. My wife's been doing it and she sent me, or vice versa. So that was very eye-opening for us, and we're happy to continue to do that for any departments who may be interested. And of course, at any of our offices, we're happy to see you anytime.
One thing I am particularly proud of is we do a scholarship for young ladies who are interested in medicine. And over the past several years, many of these scholarships have gone to the daughters of my St. Paul police officers and my Roseville firefighters. So if you have any daughters, nieces, grandchildren who are interested in medicine, have them apply for our scholarship. We would love for them to get it and to further the cause of helping people.
So once again, we recommend getting your skin checked. We have now almost 8 locations: Roseville, Eagan, Faribault, Monticello, Farmington, and Maplewood, and soon Lakeville. So I know a lot of you are all over the place. So you have our card, please call and we can get you in 3 weeks.
We can open up for any questions if anybody has any.
Questions?
This is for Chief Berg as much as for you, but so when you went to Brooklyn Center, was that Brooklyn Center reached out to you and said, we'd like you to come be part of our health processes that we're doing within our fire department, and here's a night and here's how we do that?
Well, it started actually with an internal discussion.
So all this literature is coming out amongst us doctor dermatologists that we need to get the message out to firefighters. So I said to Natalie, we need to go out and spread this word. That's why I'm here today, and that's why we reached out to Chief Berg, who kindly had us. And my colleagues went, I think we booked 2 hours of time, and we saw a bunch of his colleagues, and we detected pre-cancers and skin cancers, and subsequently many of the firefighters have come in and had them treated.
I can tell you a little bit about the process. It's just lining up a couple hours, opening it up to, I didn't have 100% participation, but we had quite a bit, and just easy. Come on in. They scheduled a 20-minute block. You come in to a private room in the fire station, get a free scan, get paperwork. You can follow up with the doctor here or follow up with your primary physician as well.
And we provide, gallons and things for changing and make it comfortable so that everybody
If we already have existing systems that bring in vendors to be able to do various health checks and screens, could we coordinate so that it's done different vendor but simultaneous time, and you would partner with them in a way?
like those logistics, sure. Pressure checks and all those things in the office, maybe before the holidays.
Everybody probably does it a little bit differently, but generally it's an annual requirement to be able to do, and it's scheduled at a time so people get a chance. Some of those are required. This sounds like it's probably more voluntary, but a great opportunity to be able to allow
We
people.
think it should be
And that-
required.
And that's what the American Academy of Dermatology thinks, is that firefighters, this should be part of their annual checklist, and it should be 100% covered by the government. I like that.
If you have insurance, your insurance will cover, again, if it's Tareen's group or, whatever other provider you go get seen by a dermatologist.
The main message here, firefighters, is you don't have to come to us, you just need to be aware. Please get in, because people do die of skin cancer, or people are very disfigured from skin cancer, and all of you give so much to the population. It shouldn't happen to you.
Other questions? Anything online? Anybody online have any questions?
Yeah, I sent them one in by chat, but how often do they recommend for routine skin checks?
So depending on risk factors, it's usually about once a year. If there's a high skin cancer burden, we sometimes see people every 6 months, every 3 months. People who are deep melanoma survivors can get metastases, so we see them much more frequently. But typically, according to the American Academy of Dermatology, which is our governing organization, if you're fair-skinned, light eyes, have a history of precancerous skin cancer, you should be having your full skin checked once a year.
Thank you.
Any other questions? Thank you for your time this morning.
Thank you.